A healthy community is one where people have good physical and emotional health. However, in Uganda, most of the communities face immense health challenges. According to the Uganda Demographic Household Survey 2011, 1 in every 19 Ugandan children die before their first birthday, and 1 in every 11 children die before their 50th birthday. Over the last decade, under 5 mortality fell from 152 to 90 deaths per 1,000 live births. Childhood mortality is higher in rural areas than in urban areas. Maternal death remains alarmingly high in Uganda. 16 women die of pregnancy-related complications every day. The maternal mortality ratio stands at 438 maternal deaths per 100,000 live births. And most of the child and maternal deaths are unfortunately preventable. The situation is not any different in most districts of the country. In Chankwanzi district, which is located in central Uganda, approximately 161 kilometers by road northwest of Kampala city, the maternal mortality ratio is 452 deaths per 100,000 live births. One of the sub-counties called Malaji has only one health center at grade 3 level where mothers seek delivery services. Nalinya Health Center 3 serves a population of over 800,000 people, many of whom are women of reproductive age and children. For the past 10 years before 2012, Nalinya Health Center did not have a midwife. Mothers moved a longer distance in search for the nearest medical health center. Traditional birth attendants remained popular even though they operated illegally.
Ogusooka twazaaliranga wano ekiboga kubanga wano emulaji tewali wabazaalisa. Ndina abaana bange 5, abasatu nabazaalira kiboga, owokuna wenyonsa namuzaalira emulaji nga bamaze kudusindikira abazaalisa.
And because so many mothers were going to the TBS, some of them would have medical complications that like overbleeding after labor. Some of them lost their babies, some of them even lost their lives. And another thing, for HIV positive mothers who were not in position of delivering from the health unit due to the lack of qualified midwife, those mothers were not captured and their babies also were infected with HIV.
Twaine ekizibu kinene nnyo myaka gyaffe gye mabega eri mu mwaka gya 2029 eyo nga tetulina basawo okunaalinya nga abakyala baffe basanga obuzibu bunene nnyo okuzaala nga bazaalira mu kyalo nga bazaalira ku bitooke abalanga bagendako kalimba mulirwa naye abatalina bukugufu mu kuzaala kw'abaana kati nga twasanga ekizibu kinene nnyo abaana baffe ne bafa nga bazaalibwa bamama baffe ne bafa nga bazaalibwa.
In a bid to seek long-term sustainable solutions aimed at improving health services and governance at the local level, the community supported by World Vision in Chiboga district employed a local-level advocacy approach known as the Citizen Voice and Action to address their challenges. Through the approach, the community identified and prioritized challenges that needed to be addressed first using the cheapest and sustainable solutions. This was done by encouraging increased dialogue and accountability between citizens, service providers, and the government. Using the approach, the community undertook a series of actions to ensure recruitment of a midwife despite inadequate government funding at the time.
CVA is about empowering community to demand and access quality service. We do this by mobilizing the community through their local leaders, religious leaders, and CBO members.
As members of the community, we embrace Citizens' Voice and Action. In this, we came up with action for issues identified in the gathering. Notable action was to forward some of the problems chosen to be worked upon by the authorities.
Oluvanyuma bamala okubaga ekiwandiiko kyabwe ne bakireeta kugombola mu kanso ey'eggombola yennyini eya sub-county Mulaji. Tumala okituulamu ne tulaba ebyali bisobokamu ebitonotono ne tubikolako ebyatulemesa ne tubiweereza ku district
council nayo n'ekiraba nga kyamaanyi era naffe ne tuyiisa resolutions ez'enjawulo okulaba nga tubeera n'abasawo naye ng'okusingira ddala abazaalisa era kye twakola twawandiika mu Ministry ya Health ne Ministry ya Public Service.
An advocacy coalition in Kiboga and Chakwanzi district created platforms for dialogue with the district council. Using evidence generated from the community gatherings, they developed a joint statement which was presented to the district council. Through this dialogue, a resolution to immediately recruit medical workers, including midwives for Nali Nyandagire Health Center, was made. However, with insufficient fundings at the district, these matters were presented to higher levels of authority at the national level.
Collectively, as various implementing partners in the district, we did write reports. A number of reports tend to come up, which were distributed, disseminated to the various stakeholders at sub-county level, at the district level, and even at the national level. We held a meeting with a committee on health from the Parliament of Uganda, where we discussed a number of issues, which included general health and the VHT issues, and amongst which the issue of shortages of health workers was presented to the members of Parliament.
We as members of Parliament in the budget conference of the district, we captured those issues and we put our foot down and we called upon the support of other MPs, and we found also they had suffered the same, and we managed to push this issue to its successful end.
The advocacy agenda at national level at the time provided an opportunity for platforms to be created where the healthy workers crisis would be addressed. The Civil Society Coalition for Reproductive, Maternal, Newborn and Child Health used evidence from Nalinya Health Center to advocate for increased allocation of funds towards the national health sector budget for the year 2012-2013. This was done by working with members of Parliament who played a major role in blocking the national health sector budget until more money is allocated to this cause. MPs were met at budget conferences and during national dialogues where testimonies were shared, and also bringing the media on board helped to keep the debate in the media arena.
So we had to mobilize ourselves as members of Parliament, particularly women members of Parliament, to ensure that we don't pass the budget. We lobbied our counterparts, the male members of Parliament, and even more people from civil society to join us to ensure that we have more funding for the recruitment of more health workers, which we did successfully.
What started as a small problem in Malaji sub-county contributed to an increment of 49 billion Uganda shillings, approximately 19,600,000 US dollars towards the 2012-2013 National Health Sector budget, specifically for recruitment of health workers. 108 health workers were recruited in Chakwanzi district. This has contributed to improvement in health-seeking behaviors, such as mothers attending and seeking antenatal services. Maternal and infant mortality rates reduced to 11% and 19% respectively in Chakwanzi district.
Currently, our staffing levels are at 71%. We have 174 health workers out of 258. There is a reduction in workload. And secondly, we are beginning to see an increase in attendance at the health facility.
Currently, we get between 80 to 100 mothers per month, and the number of deliveries has also increased. It now ranges between 15 to 20 per month, and also outreaches.
Ntambula okujja wano ku ddwaliro kindeeta wawerawo nga mita 10 kitwalira eddakiika 5 okutuuka ku ddwaliro. Empeereza ya wano ku ddwaliro nnungi kubanga bwe tutuuka abasawo tubasangawo era eddagala balituwa.
Although the community in Mulaji sub-county is happy to have a midwife, so little has been done to address other health challenges, such as the dilapidated infrastructure, limited space, lack of clinical equipment, and insufficient commodities, among others, which continues to deter the quality of services accessed. The community has gone back to the drawing board, using the citizen voice and action, a local level approach to seek solutions to some of these challenges.
So as a result of this empowerment journey of communities through using CVA as a model, we've seen the midwife being deployed in one of the dilapidated health centers of Nalinya, and equally the entire district of Chankwanzi. We've seen changes as far as staffing is concerned, to the extent that staffing has risen up to 78%. I would urge all other clusters in World Vision Uganda and equally in the entire partnership to adopt this model, because we've seen it work and we've seen it so sustainable, to the extent that communities have been empowered to demand for services, and not only in health but also in other sectors, especially education.